Hi, ma'am.
Hi, good afternoon, Dr. Priyanka.
Good afternoon.
I would request you to please not share your screen right now.
Okay, okay.
Thank you so much. I think we have most of the people have joined. I'm sure everybody has been caught up and has taken out time for this webinar. Such an important topic. So let me start with a very small thought to begin with. I would request everybody to please put their mics on mute. Chetan, if I could request you to please put everybody on mute for now. Thank you. So let me start with a small thought. They say women are complicated. But honestly, it's not women who are complicated. It's our hormones that keep updating the system without any notification. While PCOS affects many women during their reproductive years, menopause marks another significant hormonal transition later in life, and understanding both is essential for maintaining women's health. From the teenage years, when hormonal changes first begin shaping our bodies and emotions, to the 30s and the 40s, when women are balancing careers, families, responsibilities, and their own well being, just when we feel to begin, we have finally conquered it all. Well. Life has rather interesting way of reminding us and interesting, and a lot of men would agree with me on that. And yet, despite experiencing these changes, many women hesitate to talk openly about their health and delay the right medical advice they need to seek. In fact, let me ask you a couple of questions. How many of us remind others to take care of their health but postpone our own health checkups? And how often do we say, I will deal with this later when it comes to our own well being? In fact, a lot of women often find ourselves answering yes to the above questions, and for that matter, even I too. This is exactly why conversation like today's are very important. A very warm welcome to everyone joining us today for the Women's Health Awareness webinar organized by Prospera Global, where we will be discussing two important topics that affect millions of women today: PCOS and menopause. At Prospera Global, our goal is to create awareness and provide reliable medical insights that empower women to take better care of their health. Before we begin, I would like to share a small update with everyone. Dr. Rima, who was originally scheduled to conduct this session, had to attend to an emergency surgery and unfortunately will not be able to join us. We sincerely appreciate her dedication to patient care. However, we are very grateful, Dr. Priyanka, who has kindly agreed to step in and conduct this session at a very short notice. We truly appreciate your time, Dr. Priyanka. Thank you so much for the last minute. It is my pleasure to introduce our
In PCOS conditions. In such cases, the male hormones will be in a high condition. That is, the male hormone is androgen. So it will be in a high condition, which leads to several symptoms of PCOS. Hormone profile that can also be affected because of PCOS. So next is it can also affect our heart. That is because this hormone dysregularity can also affect heart, and it can lead to many conditions leading to heart disease. So this PCOS, as a result of PCOS, the androgen, that is a male hormone effect, will be in a higher condition, and it can result in rapid weight gain also for the females. So, what are the signs and symptoms of PCOS? So, the symptoms are it can vary from one person to the other person. The first and foremost symptom is infrequent cycles. The menses will be irregular, completely irregular. As told earlier, it can be either infrequent, like once in 2-3 months, or very frequent. That is, in 1 month itself, the female can have 2 or 3 cycles. So, apart from this, she can have features. in the earlier ages, very few women were affected with PCOS, but now, as because of our lifestyle problems, so between 1 in 10 and 1 in 20 women of the childbearing age group are affected with PCOS. So the prevalence range from 2.2 to 26 percentage. So 50 percentage of the women with PCOS go undiagnosed. So, what is the cause of PCOS? The exact causes may be unknown. Now, many studies have shown that genetics can also play a very important role in PCOS. Main problem with PCOS is a hormonal imbalance. So, in PCOS, there will be more androgens. As told earlier, the male hormones will be very higher. So, this higher amount of this male hormones will lead to the interference with the development of mature eggs as well as the problems which lead to difficulty in ovulation. Ovulation is the rupture of egg. So insulin can also be linked to PCOS. So there is an increased insulin resistance in women with PCOS, and also that insulin appears to increase the amylase. This is the physiological part of PCOS. Uh, how to diagnose PCOS? So, we have to take a proper medical history. So, typically the people, the women with PCOS will typically give a history of irregular cycles. When we do the physical examination from the head to toe examination, we can see the patient will be complaining of frequent fall of hair fall. She'll be complaining of hair fall. So looking to her face, she will be having lots of acne. Then she'll be having acanthosis nigricans around her neck. Then she'll be having excessive hair over her face, cheek, like on the abdominal part, thighs. Multiple small cysts to be treated. Management. And also we have to resort to more and more of exercise with focus on weight training, gym exercise, and also we have to get rid of all the unhealthy food habits. So the women who are not anxious to conceive, they are not planning fertility recent time. So we can suggest oral contraceptive pills, which will help in regularizing their cycles. And also the women with PCOS has the chance of developing metabolic syndrome. Metabolic syndrome means she has the increased chance of developing diabetes, heart disease, increased cholesterol or hypertension. So in such cases, we have to give proper management for this diabetes. So the next case is the women is planning for fertility. In such cases, we can't give oral contraceptive pill to her. So in such cases, we have to give the tablets which can induce ovulation, that can help in development of proper mature eggs in her. So that is also the treatment. we have to limit, and the food with added sugars we have to limit. We have to limit soft drinks, we have to limit cake, we have to limit chocolates, all kind of processed foods we have to limit for PCOS management. So what all we can eat? We have to include more fruits and vegetables in our meal. We have to include more of green leafy vegetables in our meal. We have to include more of proteins, that is chicken, egg, uh, legumes, moong dal, all we have to include in our meat. So we have to reduce the intake of carbohydrates. So even if we can't omit, if we can't omit all this rice, we can include parboiled rice or brown. We have to do for this lifestyle modification of PCOS. But the best thing is to go to a gym and do weight training, mainly upper body weight training, to get rid of this PCOS hormonal problems. So, what all this will help? This will help in reducing the glucose level and improve the insulin resistance and normalize the hormonal level. So, even 5 to 10% reduction in the body weight can improve our PCOS symptoms. So, what are the medications for PCOS? Do not take medications by your own. Always consult a doctor and come to the diagnosis that you are having PCOS. All patients with irregular cycles may not be having PCOS. PCOS patients, some patients of PCOS can have regular cycles also. Some patients with irregular cycles may not be having PCOS. So, this is not always interrelated. So, always consult a doctor before taking medications for PCOS. So we can take OC pills, that is oral contraceptive pills. Oral contraceptive pills originally is given for the people who are
अरे वो
doing a
सही है
family
वो
plan,
किसी
they
ने
are
उसको फॉरवर्ड किया हुआ है
postponing
तो
their
तब दिख
pregnancy.
रहा है वहाँ पे वो
So
नीचे
oral contraceptive pills can also
अरे
be
है
given
किसके
for
यहाँ से
women with PCOS to reduce the male hormonic
फीस
effect
पड़ा
of
इसकी
PCOS. So, but the problem with oral contraceptive Productive capability to incapability. So once a lady acquires a menopause, she won't So, with the aging of the ovaries, there is a reduction of all these hormones, especially estrogen. So, estrogen is a very good hormone. So, this estrogen's effect in our body, it will help us to have a very good glow. It will help our heart. It will take care of our heart. It will take care of our bones. Everything this estrogen will take care. So once we acquire a menopause, there will be a complete cessation of this estrogen, and this will see. And even when we put the fan, even when we put the AC, she'll be having too much of night sweats and hot flushes, and she'll be having a difficulty in sleeping, depression, and mood changes. So when it increases, the estrogen deficiency as it increases, the symptoms will also get worse. So she'll have urogenital atrophy. That is, it will have the tissues around the place where we pass the urine, those areas will become atrophic, and she'll be having very difficulty while passing, very pain. She'll be facing too much of pain while passing urine, and also she'll be having very difficulty in doing sexual intercourse,
Mainly
mainly
due to
due
the
to the
dry
dry
vagina,
vagina,
as well
as
as
well
the
as the
atrophy,
atrophy, that
that
is
is
the
the degeneration of the urogenital area. And also she'll have pain during urination, and she'll also have difficulty in maintaining urination while she is coughing, or she's laughing, or she's sneezing. Involuntary passage of urine can also happen. So she'll also have skin changes. As I told earlier, estrogen is responsible for glow of the female. So once we attain a menopause, the estrogen deficiency will cause change in elasticity, and skin changes can also happen for the females. So the stage 3, as it advances, it can also lead to cardiovascular, that is heart disease, osteoporosis, that bone changes and difficulty in walking, pain, always pain, bone pain she'll be complaining. And also she has
All these are the clinical symptoms. So help in assessing whether the woman is approaching menopause or not. So what
Okay.
to do if the bleeding happens again after menopause? So there is a definition criteria for menopause. So the woman, if she is not having menses for 6 months, then only we'll tell that the woman. After a pause of 6 months, you should definitely consult a doctor.
All right.
So it's always with PCOS. It will be there with PCOS. So that test will also we'll do along with these things. So previously we used to do this FSH, LH ratio. So nowadays with the ultrasound itself we can come to a conclusion of PCOS.
I see very
So
interesting two questions, Dr. Priyanka here. What medications or supplements, can be taken for post-menopause,
So,
as per you?
as told earlier, for postmenopause, if the patient is having symptoms of all these, which I told earlier, we can give medications like oral contraceptive pills can be given, HRT with estrogen and progesterone can be given, then calcium supplements can be given, then SERMs, that tibolone kind of drugs can be given. So all these things can also be given. Some
Mhm.
supplements like calcium supplements, vitamin D supplements, magnesium supplements, all these things can be given to the patient in the postmenopausal age group to get rid of some of the symptoms of her menopausal changes. So, people with having lots of postmenopausal symptoms nowadays, HRT or Tibolone, this is the mainstay of treatment for such people.
Mhm. But in India, do they still encourage HRT? Because in India, still they don't, the doctors don't, encourage HRT, do they?
Previously, it was like that. HRT people, because of the risk of cancers, estrogen therapy, cancers,
Yeah.
and all. Nowadays, more of the other kind of drugs, like not estrogen progesterone therapy, the hormonal replacement therapy with other kind of this tibolone, all these kind of calcium things, everything, these kind of things we are giving for menopausal symptoms. So these kind of drugs are not associated with all these side effects. So such
Perfect.
kind of things will also get rid of all these hot flushes, all kind of vasomotor symptoms.
Perfect. I'll take the
And
next
for
one.
local applications, the people with dry vagina and all, and this urogenital symptoms like recurrent urinary tract infections and dry vagina difficulty in sexual intercourse, such kind of people, we can give estrogen creams that can be
Mhm.
applied locally, and this has also proved to have so much of difference in their symptoms.
All right. I'll move on to the next question. Can PCOS be reversed?
PCOS can be reversed with proper lifestyle modification. So, in the people who are more prone for PCOS, if the lifestyle modification, if they do proper lifestyle modification, the PCOS can be cured.
All right. Next question is, how long do we have to take the treatment? Aren't hormones given harmful? I think we're coming back to the HRT this one. The
So we
treatment
can
for
give.
HRT, I mean, how long? I think the question is basically how long do they continue to take the HRT, and are these HRT harmful? But you've already addressed that, so we can take this one as to how long does one has to take the HRT.
So we can give HRT as long as her symptoms are improving. How much time she's needed, we can give the HRT treatment. But regular follow up should be taken every 3 months. She should come to the hospital, and routine follow up and scans has to be done while
Mm,
she is on HRT.
HRT. So there's
So
no
while when she
specific
is
time
taking
limit you're
HRT,
saying. It has to be regularly monitored.
yeah, at least every three, she'll be given tablets for like 3 months. So after 3 months, she has to come back, and she should not take over the counter drugs. She should come back to the hospital, and we have to again look how the symptoms are improving, and we have to do a scan for her. All these things we have to do, and then only we can give the next set of drugs. So once a patient is approaching the menopause, for some time she'll be having all these symptoms. So after sometimes all these symptoms will start reducing. Or these
Got
hot
it.
flushes and things, she'll start reducing. But these
That is important.
calcium supplements and bisphosphonates, all those things, no, she can take as long
Mhm.
as she wants it.
Got it. Got it. Thank you so much. Moving on to the next one. Will drilling cause end to PCOS or will it reoccur?
So drilling is considered as a final resort of PCOS. When the patient is having a resistant PCOS, she's not responding to any of the ovulatory drugs like letrozole or clomiphene. She's not responding to any of the drugs. Will be resorting to drilling. So drilling doesn't mean that the PCOS is gone. So once the drilling is done, for some 3 to 6 months, she can have a normal pregnancy. So after that, again, because of this hormonal effect, the PCOS will be recurring. It will recur definitely.
All right. How does PCOS affect fertility and what treatment options are available for women who want to conceive?
So PCOS, as I told earlier, in PCOS there will be multiple cysts, very few small multiple cysts are there. So it is assumed that every cyst will contain one egg. So every cyst will contain small egg, but none of them are matured. So for a normal female, in one cycle, there will be just one egg and it will mature and it will be released, ovulated, and it will combine with a sperm and it will lead to an embryo, that is a baby. So, but in case of PCOS, there will be lots and lots of small cysts, but none of them are mature. So what happens? None of them are mature. All are immature means none of them will lead to ovulation. So none of them can come out and none of them will fertilize with the sperms. So there is no possibility of getting pregnancy in a PCOS patients. So in PCOS, for fertility management, what we are doing is that we will give tablets to take care of one egg. So when we give tablets and injections, just one egg will be developing from that because of adequate hormones which we are giving through tablets. At least one of the egg will be developing. So one egg will be developed and it will be mature and it will be released by ovulation and it will mix with the husband's sperm and this will lead to a baby. So that is what we are doing in PCOS. But even with ovulatory agents, no, some patients won't conceive. That is a very resistant and severe PCOS patients. In such cases, we will have to resort to IVF.
All right. All right, we'll take the last question for the session, which is how important is pap smear test in menopausal stage, or when should a girl start taking this test?
So this is a very important test. So nowadays, the pap smear and cervical screening, HPV vaccine, everything has gained much importance. Pap smear is a very important test, cervical screening test. So you all know that cervical cancer is the second most common cancer in women of India. So first is a breast cancer and the second is a cervical cancer. So cervical cancer is mainly caused due to this virus, this human papilloma virus. So if you take the human papilloma virus vaccine, that is the HPV vaccine, at a very early age, that is before starting sexual activity, we can prevent cervical cancer to about 90 to 95%. So the government of India has implemented this HPV vaccine, which is an optional vaccine now also to girls of 9 to 14 years of age. So 9 to 14 years of age, let go. 9 to 14 years of age girls, we are giving two vaccines, that is two doses of this vaccine, and also this will help them prevent cervical cancer. So this HPV, human papilloma virus, causes cancer of the cervix, vagina, penis, throat, everything it can cause. So this can be given to boys also. So we can also take this cervical cancer, this HPV vaccine after 14 years of age also, but we have to take 3 doses. So even if you take this human papilloma virus vaccine, we have to do routine pap smear screening. So pap smear screening has to be started from the age of 21 years. That is because that is the age where the women of India start having sexual activity. So once the women has started sexual activity, we can start pap smear screening. So once up to the 30 years of age, this can be done every 5 years. So only every 5 years it's needed. So after 30 years of age, this has to be done every 3 years. This pap smear screening has to be done every 3 years. And with HPV DNA testing, that has also been done. So if the lady has undergone this pap smear screening as per the Government of India's schedule and she has found to be negative for everything, after 65 years of age, there is no need of doing pap smear at all. So this pap
Okay.
smear, it's very easy and it's very cost effective and very simple test. This the lady, one woman has to do a pap smear at least once in her lifetime. That's what is
One
that.
second. All right. All right. Before we end the session, one interesting thing, another question that I would like to take up, Dr. Priyanka. Can they send their medical report to Dr. Priyanka to discuss further their medical condition? Is that possible if somebody wants to share their medical reports with you? So, you can discuss the medical condition further, their medical condition further.
Now,
Not now, later after the session.
yeah.
Yeah, we can do that. All right. Perfect. Thank you so much, Dr. Priyanka, for your time.
Thank you so much.
Okay, thank you. Thank you, Nancy, and thank you, Dr. Priyanka. So we come to the end of this session. We hope this session has been informative and helpful, and that the insights shared today will encourage greater awareness and proactive care for women's health. At this moment, I would like to extend our sincere thanks to Kinder Hospital team for their support, and a special thank you to Dr. Priyanka for sharing her valuable knowledge and insights with us today. You were truly amazing. Okay, I would like to also thank my team. So we appreciate Nancy, our wonderful MC, for smoothly hosting today's session, Dr. Sonia and Vijay for coordinating this webinar with the hospital, and of course our IT support led by Chetan for making this session possible. Okay, for those who would like to revisit the discussion or share it with others, the recording will be available on YouTube, where you can watch the full session again. And we look forward to bringing you more and more such informative sessions in the future. Before we conclude, I would like to leave you with one thought to reflect on. A woman who takes care of her health empowers an entire generation. On that note, we conclude today's webinar. Thank you once again for joining us, and we wish you all a safe, healthy, and productive week ahead. Thank you so much, everyone. Thank you.
Thank you so much. Thank you, Dr.
Bye
Priyanka.
bye. Cheers. Bye.
Bye.